Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Keep on smiling. Good dental care for the older adult.
When you're smiling, the whole world smiles with you. That song brings back a lot of memories. It was written about the same time I played sax with Ted Lewis. Our job was to get people to smile and feel happy. "Is everybody happy?" Ted would ask. He hypnotized them with his smile and song. We had a lot of good times on and off the stage.
That song does go back a few years, and over time things have changed, not only in musical styles, but even in the practice of dentistry. Things are different.
My father had a difficult time going to the dentist, so when we would go with him to the dentist, we would wait outside on the sidewalk. There was an outside stairway, and at the top was the dental office. Then we heard these terrible screams and hollering, just because he was getting his dental work done.
Not only have there been changes in avoiding pain, but dentists are using new techniques and materials.
Well, I was afraid to go to the dentist as a child. I had a few bad experiences of pain, so for many years I just wouldn't go. Well, now that I'm older, I've discovered that there are so many new techniques used that a visit to the dentist is practically painless, maybe some discomfort occasionally. By and large, the anticipation of going is far more excruciating than the pain. You know, I've had some bonding done on my teeth, and it's amazing, but my appearance changed dramatically.
Well, I feel that over the years there have been a big change because I was awful afraid to go to the dentist. But now I don't have that fear. You don't feel the pain you did years ago. I feel that people shouldn't be afraid because they have different things now to ease the pain. The pain is much less than it was years ago.
Over the decades, we've all experienced changes, but one thing that hasn't changed is the importance of staying as active and as fit as possible, enjoying ourselves, and having a pleasant smile.
When you're smiling, the whole world smiles with you. When you're laughing, the sun comes shining through. But when you're crying...
But sometimes we forget that oral health is an important part of our general health and is often neglected. Did you know that a large proportion of people 65 and older have not been to a dentist in the last 5 years? And a health survey reveals that about 60% of all persons aged 65 to 75 have untreated dental problems. Are you surprised that a health survey includes oral care? Well, just as we see our physicians on a more regular basis as we grow older, we should see a dentist more regularly too. And that's true even if we didn't see a dentist regularly before.
When I was a youngster, nobody thought about their teeth. They didn't have money to go to the dentist. So people only went when they had a toothache. As I became older and things were better financially, I started taking care of my teeth and gums and going to a dentist on a regular basis.
When you need dental care and your budget is limited, look for help within the community. free screening or special low-cost dental programs are often available. Also, talk to your dentist about deferred payments or your insurance.
Money is always a problem to someone on a fixed income. I think finding a dentist who is willing to take monthly payments is a big help.
Remember that old phrase, an apple a day keeps the doctor away? Well, does it really? For some health problems, neglected oral care could mean that you can't enjoy that apple or other nutritious foods, and a poor diet can affect your overall well-being. So, in many ways, this apple does symbolize helping to keep the physician and dentist away. Some people grow up with strong teeth and gums. They inherit them and have few problems even though they haven't had regular dental care.
It's interesting to realize that in this modern life that I was 21 years of age before I saw a dentist at all. We were, as children, taught to brush teeth mainly with soda, and I believe there was a mixture of soda and borax that we used to mix that we used on our teeth at the time. At that time, we didn't have fancy toothpaste, but I guess this mixture of soda worked. When I did go to the dentist, they found 3 cavities in 3 different teeth. I guess I was blessed with pretty good teeth to start with, since I didn't see a dentist for the first 21 years of my life.
On the other hand, even with regular dental checkups and good home care, some people always have problems.
I've had problems with my teeth for a number of years. It's not that I've neglected my teeth. I've been to a dentist every 6 months. But somewhere along the line, they started deteriorating.
There are many factors which affect how susceptible we are to oral problems. But for all of us, a healthy mouth begins with keeping our mouth and teeth, or dentures, clean. Daily care removes the sticky food or plaque which contributes to decay and bad breath. What is plaque? Plaque is a colorless layer of germs that constantly forms around your teeth. It collects between the teeth and around the gum line. These germs combine with the sugary and starchy foods that we eat and form acids which can dissolve the outer layer of the tooth and create decay, or a cavity. Cavities are not the only problem caused by plaque. If plaque is not removed from the teeth and gum lines with daily brushing and flossing, it will form into a hard substance called tartar, or calculus, which can only be removed by a dentist or dental hygienist. Plaque or calculus may cause gum or periodontal disease. The irritants in plaque cause red, swollen, bleeding gums. As plaque and calculus collect, gum tissue begins to pull away from the teeth. Eventually, the bone that supports the tooth is destroyed, and the tooth becomes loose.
When I was younger, my teeth was perfect. But as I grew older, I neglected them, and I didn't go to see the dentist as often as I should. Now, I'm having problems with pyorrhea. I didn't even know each time I was brushing my teeth, my toothbrush would have blood on it.
Today, we call pyorrhea, or gum disease, periodontal disease. This is a silent disease, and a dental professional is needed to check the condition of your gums. Periodontal disease results in infection, bad breath, and the loss of teeth. Did you know that most adults lose their natural teeth not because of decay, but because they have periodontal disease? Although this disease is treatable, it is not reversible. It's a chronic condition that must be managed by having periodic visits to a dental professional and your own daily care.
I knew I had trouble with my teeth, first of all, because a couple of my front teeth were loose. I knew that I was in trouble, that I had to have something done. They said that if I had the time and patience, they could do something with my mouth. I was so delighted to know that I could save my teeth.
I think I waited too long because my gums are so weak now. So I'm having the problem of getting some false teeth. Now that I've lost some of my teeth, I feel really embarrassed when I'm out. I don't like to talk to people that I already know. I have my teeth out and I hate opening my mouth. I get really embarrassed when I see someone I know. I smile and they look in my mouth. I have noticed that by having these teeth out, that sometimes my speech isn't as good as it was when I had my teeth in.
Our daily basis is as important as regular visits to the dentist. Techniques for caring for our teeth include daily flossing and brushing. This reduces decay and retards the development of gum disease. First, remember to floss. It's the best way to keep the gum tissue between the teeth clean and healthy. Second, brush your teeth to remove the plaque, stimulate the gums, and freshen your breath. Last, brush your tongue. Bacteria is all over your mouth. If you brush your tongue, you'll find that your mouth will feel cleaner. Your food will taste better, and your breath will be fresher. Not all of us are fortunate enough to still have our natural teeth. However, dentures don't have to be a problem. New materials allow people to be fitted with dentures easily and comfortably as never before. Properly made dentures should enable you to be confident in social situations and to eat most foods.
I'm 83 years old, and I've been wearing dentures for close to 40 years, and I've had no problem with them. They work perfectly, and I wouldn't be without them. I wouldn't go back to my old teeth for anything.
Your dentures and gums require the same daily care as your natural teeth. Without daily cleaning of your mouth area, plaque can cause the same negative conditions in your mouth as it does with your natural teeth. If it isn't removed daily, the calculus that forms can irritate the gums underneath your dentures, causing soreness, and can even change the fit of your dentures. Also, plaque and calculus cause bad breath and a bad taste in your mouth.
I use Polydent every night before I go to bed. And I take my teeth out and leave them in the water with the Polydent until morning. And that does a better job of cleaning than anything else I've found. I also brush them.
Good denture care includes daily removal, soaking, and brushing of the dentures with a special denture brush. It also involves using a soft toothbrush to clean your gums, tongue, and any remaining teeth. Many people with dentures think that they're not having any problem with them. But recent studies indicate that people with dentures who think everything is okay often have outright disease in the gum tissue underneath their dentures. In addition, your dentures may fit well now, but with time, the bone and gum ridges that support the dentures can very gradually change, and those changes can affect the way your dentures fit. So remember, even though you wear dentures and you don't think you're having problems, see your dentist regularly, at least once a year.
My dentures fit well, and nothing bothers my eating, but they are beginning to get a little loose. I'll have to get them relined someday.
That's right, Mr. Thompson. If your dentures are loose, don't settle for unnecessary discomfort. Your dentist can help in many more ways than you might think. Your dentures can be repaired if they break or crack, and relined if they're loose. But please, don't try to repair your own dentures. You can ruin them. Also, new materials and procedures like implant dentures and soft liners allow people to wear dentures who couldn't wear them before. Whether you have dentures or your natural teeth, being an older adult may present you with some special concerns and problems. If you see or feel a sore place in your mouth, it should not be ignored. Call or visit your dentist if it doesn't go away in 2 or 3 weeks. Many of you may be taking several medications per day, some of which can affect the condition of your mouth. Dryness can be a side effect of taking a particular drug. Drinking more water can help with this problem. If it persists, however, talk with your physician, dentist, or pharmacist. They can help you to relieve this problem. And it's especially important to maintain contact with your dentist if you're involved with special medical treatments such as chemotherapy or radiation. Such treatments can seriously affect the condition of your teeth and gums. Some people have difficulty grasping the narrow handle of their toothbrush. This problem can be solved by attaching to the brush handle a rubber ball, a bicycle handle, a foam rubber hair roller, or washcloth secured with a rubber band. On the other hand, some people like the ease of using an electric toothbrush or a dental floss holder. Let's face it, as we grow older, many of us may have health or physical concerns which we didn't anticipate. However, with daily care, we can have a healthy mouth. When seeing your hygienist or dentist, ask about the condition of your gums and teeth, and ask about any new dental products or techniques you've heard about.
I think prevention in regard to teeth is very important. There's some people who don't believe in it. They think it's foolish and don't want to spend the money for it, much to their detriment because they'll have many more problems afterward. So I'm a firm believer in dental prevention.
There are benefits from having your mouth and teeth in good order because you have more confidence in yourself. I smiled more readily because I knew I didn't have to worry about the problem I had. I felt like a different person.
Good oral health requires commitment to everyday care, which includes examining your own mouth and regular appointments with your dentist. And when you're there, don't be afraid to ask questions and discuss your concerns. The staff is there to help you. Having a healthy mouth allows you to look good, enjoy eating, and, of course, lets you keep on smiling with confidence.
I would say that regardless of age, 60 or 20 years, that people want to look and feel good and to be active participants in our society. Taking care of your teeth helps tremendously in this respect. I think you'll be happier. It certainly will be less trouble if you can prevent some problems with your teeth from happening.
When you're smiling, the whole world smiles with you. When you're laughing, the sun comes shining through. But when you're crying, you bring on the rain, so stop your sighing. Be happy again, keep on smiling, 'cause when you're smiling, the whole world smiles with you. Keep on smiling, 'cause when you're smiling, the whole world smiles with you.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.